Meeting to order. All right, welcome to the August 16th regular meeting of the Commission on Homelessness. We will begin, as always, with the Pledge of Allegiance. And if you would all stand, let me ask one of our newcomers, Commissioner Morris, to lead us in the pledge. Would you, sir?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, thank you all. The agenda for today contains a brief description of each item to be considered. Except as provided by law, no action shall be taken on any item not appearing on the agenda. The Commission on Homelessness encourages public participation. If you wish to speak on any item appearing on the agenda or during general public comments, please complete a speaker request form and turn it in to the clerk prior to the reading of the item. Speakers will be given 3 minutes to speak. The clerk will run the timer and announce when your time is up. Public comments may be submitted electronically by emailing response@ocgov.com. With that, we move on to the roll call. Madam Clerk.
Thank you. Please indicate your presence when I call your name. Commissioner Sarmiento,
Here.
Commissioner Wagner,
Here.
Commissioner Vanderpool, Commissioner Rich. You say Rich? Here. Commissioner Rose. Commissioner Parks. Here. Commissioner Van.
Here.
Commissioner DeMetropolis.
Here.
Commissioner Cornwall. Here. Commissioner Davis. Commissioner Twan. Commissioner Ibn. Commissioner Spitzer.
Here.
Commissioner Searcy.
Here.
Commissioner Fable.
Here.
Commissioner Wyatt.
Here.
Commissioner Pionic.
Here.
Commissioner Rios-Faust. Here. And Commissioner Morris.
Here.
Thank you. Chairman, we have a quorum.
Thank you very much. A quick housekeeping item. As a reminder, please be aware that the room is hot mic, the live stream of the meeting. Commissioners, if you're soft-spoken, unlike me, please try to speak a little louder so that the microphones may pick up your comment for the live stream. Please try to keep side conversations to a minimum so they may be picked up, because they may be picked up by the microphones throughout the room. One more housekeeping item. If I could get the script in a little bit bigger font next time. That'll bring my glasses. We will now move to the agenda for today and we'll begin with our discussion item. Madam Clerk, would you please read the first item?
Item 1 is the Office of Care Coordination update, which includes updates on membership and the 2023 homeless survey. And we have no request from the public to speak on this item.
All right, thank you very much. And to kick this item off, I would like to welcome our newest member, Christine Ridge, to the Commission on Homelessness. I am certain we all, and I know I look forward to working with you on the commission. So welcome. Comments?
No, thank you for having me. I actually served on this commission shortly after it was formed back in 2007. A lot of different faces now. I recognize most of you, so I'm very excited to be here. And it's a really important issue, and it's the #1 priority in the city of Santa Ana when you talk to our community members is addressing homelessness.
Well, welcome back then. Glad to have you for a second stint. Let me turn it over now to Mr. Beck, and if you would give us the update for today.
Yeah, thank you, Mr. Chairman. So good afternoon, everyone. Thank you again for coming to another commission meeting. As I often do, I start out with membership updates as we just covered. We're excited and welcome City Manager Christine Ridge from Santa Ana onto our commission. Very excited to work to have her as part of our work with us. Another update that I'd like to provide, sticking to the membership topic, is that we currently have an open recruitment for several seats that are either about to expire or are currently vacant. Those seats include the Chief of Police in Orange County, in an Orange County city, Affordable Housing Development Industry Representative, City Manager or elected official in the North Service Planning Area, faith-based community representative, and an at-large seat. If folks are interested, I highly encourage folks to please visit our website listed here, which is essentially Google Commission to End Homelessness Orange County. It'll also lead you to this website. If you have any questions, feel free to reach out to our office as well. Give a little bit of context around the timeline of this recruitment. As I mentioned, the application is open. The application period is open till August 31st. When that closes, the existing ad hoc committee, membership committee, will review all applications and bring back their recommendations to our October meeting for the commission members to vote on endorsing those folks up to the Board of Supervisors for final approval. If and when that happens, the next step will be bringing those nominated folks to the Board of Supervisors at a November or early December meeting for final approval, which will allow those seats to be represented with new people in them or continuing people in them to be seated for our December meeting. I'd also like to take a second to provide a brief update on our 2023 homeless survey. So I've provided an update the last couple of meetings. Our office, along with CityNet, is currently at the tail end of finalizing the data and drafting an initial report, which, as a reminder, the data includes essentially surveys from over 625 people, and a high majority of them were asked over 40 questions. We've had a meeting with our ad hoc group here at the Commission on July 26th to update them on progress, and we'll be meeting with them later this month or early September to review the data and create and discuss findings and recommendations. Ultimately, we will be presenting the entire report, including the findings and recommendations in our October meeting. With that, that ends my updates.
All right, thank you very much. Any questions or comments from any of the committee members? Well, why not? Go ahead.
You knew I would be a talker.
Yeah.
Just a question, was it CityNet individuals that conducted the actual surveys, or did you use a large volunteer?
No, the county contracted out with CityNet and their staff collected surveys during the month of May. Throughout the month of May.
All right, thank you very much. Anybody else? Anything else? All right, thank you for that. Let's move on now to item 2. Madam Clerk, if you would read, please.
Item 2 is a presentation titled California Statewide Study of People Experiencing Homelessness, presented by Tiana Moore, PhD, Policy Director at Benioff Homelessness and Housing Initiative, University of California, San Francisco. And we have 0 requests from the public to speak on this item.
All right, thank you very much. Do we have Ms. Moore with us today?
She's right next to me.
Oh, there we are. All right, very nice. Ms. Moore, welcome. Thank you for joining us and presenting your findings. Let me, before we hear from you, let me kick it over to Doug and see if he wants to do anything further by way of introduction.
Yeah, absolutely. So we're incredibly excited to have Dr. Moore here today. As many of you remember, at our June meeting, we provided the executive summary and had a brief discussion about some of the executive findings and how robust and how robust this survey is. Since that meeting, we reached out to Dr. Moore and asked if she'd be willing to come down and present the study to its full extent, because it is a dynamic study, and we really appreciate her being here. To provide a little bit of an introduction to Dr. Moore, she serves as the Policy Director for the UC San Francisco's Benioff Homelessness and Housing Initiative, and is the co-author of the recently released report on the California statewide study of people experiencing homelessness that we'll review today. As a policy director, Dr. Moore translates academic research into evidence-based and actionable policy guidance. Prior to joining BHHI, a new acronym for us, Dr. Moore earned her PhD in developmental psychology with a research focus on housing and neighborhood level influences on child and family well-being. Notably, her work has examined the influence of HUD's rental assistance demonstration on child well-being, resident engagement practices in public housing demonstrations, the effects of housing instability on health and academic performance, and associations between neighborhood incarceration rates and maternal child health outcomes. So like I said, we're excited to have Dr. Moore here. I'm going to pass it over to her in 1 minute. What we're looking to do is allow Dr. Moore, she's going to present from here and go through her slides fully, and then we'll have plenty of time for questions afterwards. So essentially, I'm asking if we could sort of track our questions throughout it, and then when Dr. Moore is done, we'll open for discussion. So.
Thank you so much, Doug. Good afternoon, everyone. My name is Tiana Moore. I'm really grateful for this opportunity to share a little bit more about this California statewide study of people experiencing homelessness. I know everyone has the executive summary in their packets right now, but I also want to direct you all to the full report. It's a little more robust. It's about 95 pages or so, but it allows kind of the full breadth of the data to be explored if you go to homelessness.ucsf.edu/CASPA. And with that, we'll get started. So the California statewide study of people experiencing homelessness is the largest representative sample of homelessness in the United States since the 1990s. It was conducted at the request of Dr. Mark Galley, who's the California Secretary of Health and Human Services, really at a time where the state was really interested in making big investments in homelessness prevention, homelessness services, and really wanted to make sure that they were doing so in a data-driven way. I want to make sure that it's very clear that even though Secretary Galley was interested and had us asked us to kind of conduct this study, we are independently funded. So we funded it by ourselves, and we funded it partially by the California Healthcare Foundation and also by the Blue Shield of California Foundation. So the state did not participate in funding this study. And to give context as to why the issue is so important right now, California has 12% of the entire United States population, but 30% of all people experiencing homelessness live in California. And further, half of all people experiencing unsheltered homelessness live in California. The study really had 5 primary aims. The first was really to understand the characteristics of adults experiencing homelessness in California, to understand the precipitants or what was really happening in the lives of individuals before they experienced homelessness, to understand the impact of the pandemic on homelessness, understand with a little bit more granularity people's experiences while homeless, and then finally to really understand what barriers exist to exiting homelessness and reobtaining housing for individuals. The study is notably different from the PIT in many ways. The PIT count, the point in time count, which is the annual count of that COCs conduct. It's not intended to enumerate the number of people experiencing homelessness in California. We had no intention of counting the number of people. It's a mixed method study. So we employed both a survey questionnaire and also qualitative in-depth interviews with participants. We conducted representative sampling. So essentially, rather than producing kind of county level estimates, we were hoping to generate estimates that represented the entire state of California. So the focus isn't really on one particular county within the state. It's really a focus on what homelessness looks like across the state of California. And a quick note about methods. So essentially, we carved California out into 8 regions and sampled randomly a county within each of those 8 regions that stood in for that region. We can't kind of share what counties we were in, with the exception of Los Angeles, because it itself is its own region, just because of the enormity of the space. The target population, we were interested in understanding adult experiences of homelessness. So 18 and over was the kind of age criteria that we used for eligibility. Overall, we conducted about 3,200 questionnaires, 365 paired in-depth interviews with people, where we were able to get a little bit more open-ended answers from them around a variety of topics. We employed venue-based sampling with respondent-driven sampling. So venue-based sampling is essentially just sharing that we met people where they were. So we were in encampments, we were in hot food lines, we were in libraries, places that people experiencing homelessness typically exist. And then also we supplemented that with respondent-driven sampling. And this is a statistical technique to really try to reach harder to reach populations. So in California, that includes farm workers, that includes our LGBTQ people, and it also includes our transition age young adults. And again, we sample weighted it for the entire state. And interviews were conducted in both English and Spanish. And then for participants who required support in another language, we employed interpreters. And finally, which I think is really important, is that we really kind of embrace community engaged practices at all points throughout the study. We had 3 community advisory boards. One community advisory board was comprised of people with lived or living experience of homelessness. And they guided us through the development of the study survey instrument, and also kind of the interpretation and dissemination of findings that we're doing right now. So I wanted to kind of preview some of the highlights of the report as much as I can do in the 30 minutes that I have with you all. And the report is kind of segmented into 5 chapters. The first being who experiences homelessness in California. The second being pathways to homelessness. So what were the trajectories that people experienced along their journey to homelessness? The third is experiences during homelessness. So we asked a lot of questions about health status, behavioral health, experiences of violence enacted upon them during homelessness, employment, et cetera. Barriers and facilitators of returns to housing, which again are thinking about what participants identified as some of the key barriers to preventing them from exiting homelessness. And then finally, we talk about policy recommendations. So starting with who experiences homelessness in California, in alignment with federal definitions of how the federal government kind of categorizes people, 90% of our sample were single adults, and these are adults that are 25 years or older without minor children living with them at the time. 7% of our sample was adult and families, and these are adults that were 18 and over who had minor children living with them. And 3% of our sample were transition age young adults. And these were individuals who were 18 to 24 without minor children living with them at the time. We recognize that even with the respondent-driven sampling methods that we use, we probably undercounted our transition age young adults a little bit. It's really hard to reach this population, but I think what is important is that we still are very confident in our results around kind of what we have amongst the population that we were able to sample. And importantly, although 7% of our sample were adults and families, an additional 8% of all of our participants had shared that they had given up custody of a minor children due to homelessness, so they would otherwise be categorized as an adult and family if they were living with their children. In terms of some key demographics, so our Black and Indigenous communities were disproportionately impacted. With regard to our Black population, 26% of our sample indicated Black identity as one of their identities, either their sole identity or one of their identities. And that's compared to, if you look across the state, about 7% of people do so. With regard to our Native American, Alaska Native, Indigenous communities, in our study, 12% of individuals identified as Native American, Alaska Native, or Indigenous. However, if you look at the statewide estimates, it's about 3%. So the great overrepresentation of these two groups. With regard to gender, about 69% of our sample were cisgender men, 30% were cisgender women, and 1% of our sample identified as trans, non-binary, or other gender identified. If we look at our transition age young adult sample, it's about 6% of those individuals who identified as trans or non-binary. And finally, which I think is really important to know for everyone, is California's homelessness population is aging. The median age of all of our participants was 47, and we interviewed folks from 18 to 89 in our study. But when we look at just the single adults, the median age is 49. And importantly, in our study, about half of our participants were 50 and older when we interviewed them. And 41% of those single adults were 50 and older when they first became homeless. Episodes of homelessness were long. So the median length of the current episode of homelessness for our participants was 22 months, so nearly 2 years. And 1 in 3 of our participants met federal criteria for chronic homelessness, and that includes both the temporal criteria and also a disabling condition. So the temporal criteria meaning you've experienced homelessness for at least 12 months or 4 times within the past 3 years that equal to 12 months or more, and also have a disabling condition alongside that. 36% of our participants met those 2 criteria. People experiencing homelessness in California are Californians. 90% of our participants were last housed in California. And people aren't moving these great distances from where they last lost their housing. So 75% of our participants were last housed in the current county in which we interviewed them in. So I think it's important before we kind of jump into some of the behavioral health findings that we have across the lifetime to really emphasize that homelessness does not occur in a vacuum. Experiences of stress and trauma are often kind of undergirding the experience of homelessness for many. So with regard to incarceration, 79% of all of our participants were either spent time in jail or prison during at any point in their lifetime. 77% spent time in jail and 37% I should say, spent time in prison. With regard to violence enacted upon individuals, 72% of people indicated that they had experienced physical violence at some point in their life. With regard to sexual violence, about a quarter of participants indicated that they did. And this was much higher for our cisgender women and our trans non-binary gender non-conforming participants, where 43% of all women that we surveyed indicated that they had experienced sexual violence at some point in their life. In our trans gender non-conforming participants, 74%. So with regard to mental health, we asked participants to kind of share their self-reported mental health conditions, and this is at any point in their lifetime. 82% of our participants had any mental health condition, and this was primarily driven by severe anxiety, severe depression. 49% indicated that they had trouble remembering, concentrating, or understanding, and this is often a symptom of kind of underlying cognitive impairment. 49% indicated this. And then finally, 23% of all of our participants at some point in their life had experienced hallucinations. Hospitalization for mental health concerns is often another kind of indicator of severity. 27% of our participants were hospitalized for a mental health concern at some point in their life, not just during the current episode of homelessness. But 56% of these participants were hospitalized prior to experiencing homelessness. And one of the more striking findings that we had was that 1 in 3 of our participants had actually made an attempt at suicide at some point in their life. And this is not just kind of suicidal ideation, this is an actual attempt. Similarly, substance use, when we think about, we asked our participants both about kind of illicit substance use and then also alcohol. Across the lifespan, 65% of our participants at some point in their lives engaged in illicit substance use 3 times a week or more. So that's kind of the criteria that we considered as regular substance use. 56% of those individuals had reported that methamphetamines was the regular substance that they used. 22% indicated opioids and non-prescription opioids. And then finally, 33% indicated regular cocaine use. With regard to alcohol, we asked participants if they had ever drank alcohol 3 times a week or more with the explicit purpose to get drunk, or less frequently, but more heavily for shorter periods. And by this marker, 62% of our participants said so. And another kind of striking finding is 1 in 5 of our participants experienced an overdose that required medical intervention at some point in their lifetime. So I want to talk a little bit about pathways to homelessness. So these entrances to homelessness really differ by participants. About 1 in 5 of our participants entered homelessness directly from an institutional setting, primarily exiting prison, primarily exiting jail. When we think about the rest of the participants in the study, the other 80%, 49% of all of our participants entered homelessness from non-leaseholding arrangements where they were kind of doubled up living in informal arrangements where their name wasn't kind of formally listed on a lease. And 32% of our participants entered homelessness from a leaseholding arrangement where their name was either directly on a lease or in very rare instances on a mortgage. And what I think is important to note is that there's not a single pathway to homelessness. Some people reported this kind of rapid transition to homelessness, while others talked about kind of using their limited financial resources, using their social networks to really slow their descent into homelessness until it inevitably happened. Income and housing costs play a big role in increasing vulnerability to homelessness. So across all of our participants, we asked about their monthly income in the 6 months prior to experiencing homelessness. Across the board, median monthly household income in that period was $960. We also asked about monthly housing costs, and for all of our participants, it was about $375, but I think that number is a little kind of deceiving because it might be partially driven by the fact that 43% of our non-leaseholders didn't pay rent during this time. When we look at our non-leaseholders, the income was pretty similar. So $950 was the median monthly household income for our non-leaseholders. And for the non-leaseholders who actually paid rent in their last housing arrangement, it was about $450 that they were contributing. So about half of their income was going toward rent. With regard to leaseholders, it's a similar story. About half of the income was, half of your household income was being contributed toward rent, but the income was a little bit higher. So our leaseholders had a median monthly household income of about $1,400, which is still untenably low in the state of California. Participants had very little warning prior to losing their last housing. We asked our participants to recall how much warning they had before they actually had to leave their last housing arrangement. On the median across all participants, it was 5 days. Amongst our non-leaseholders, it was 1 day that they had noticed before they had to leave. And amongst our leaseholders, it was about 10 days. And we suspect that leaseholders might be a little bit higher because they might have gotten an eviction notice and didn't realize that they had recourse to address it and decided to leave out of fear. We asked our participants a range of questions about kind of reasons that they left their last housing. We asked about all of the reasons, and we also asked them to identify the primary reason as well. With regard to all participants, 12% indicated that lost or reduced income was the primary reason that they left their last housing. When we look at our leaseholders, it's a little bit higher. So lost or reduced income, about 1 in 5 individuals who were leaseholders indicated that that was the primary reason that they left their last housing. When we look at the middle section, which is for our non-leaseholders, oftentimes our non-leaseholders commonly reported these kind of interpersonal or social reasons for leaving their last housing. But really what came through in the qualitative interviews that we supplemented this with was that oftentimes people were living in these kind of contentious or overcrowded housing situations. Many times non-leaseholders were not paying rent, causing additional tension. And so although our participants kind of noted that this kind of conflict was the immediate precipitant, it was pretty clear that these kind of upstream factors, these economic factors that forced them to live in these kind of contentious situations were really kind of driving their reasons for losing their housing. We asked broadly about help sought and received prior to homelessness. About a third of our participants, 36%, said that they sought help from any source. Our participants who were classified in adults and families, so those living with minor children, sought support more often. So 61% of those individuals had sought support. And we asked about a range of sources of support. Most commonly, people indicated that they sought support from their friends and family, more so than kind of government organizations, community-based organizations, legal services, or the like. And then finally, with regard to receiving help, only about a quarter, less than a quarter of our participants indicated that they received help. And again, adults and families were more likely to, half of our adults and families, they received some form of help prior to experiencing homelessness. I want to kind of circle back to the population that we talked about of those entering homelessness from institutional settings. We asked our participants, particularly those who exited prison and jail into homelessness, what kind of re-entry support they received upon exiting. We asked about signing up for benefits, we asked about signing up for healthcare services, and we asked about support finding housing. Across the board, for those exiting jail and for those exiting prison, it was less than 20% of individuals who reported support finding housing, support signing up for healthcare services, or support signing up for benefits. And finally, we engaged our participants in a thought experiment of sorts. We asked them to kind of go back to the period in which they knew that they were going to leave their housing and think about kind of 3 hypothetical prevention interventions that would have helped support them. And we were interested in interventions that would have stabilized their housing for at least 2 years. So we asked about a monthly shallow subsidy of $300 to $500. Would that have helped? We asked about a $5,000 to $10,000 kind of one-time lump sum payment. And then we finally asked about a deep rental subsidy similar to a housing choice voucher, which limits your rental contribution to 30% of your income. 70% of our participants indicated that a monthly shallow subsidy would have helped stabilize their housing for at least 2 years. 82% indicated that that one-time lump sum payment would have done so. And then finally, 90% of our participants indicated that a rental subsidy, such as a housing choice voucher or similar, would have helped stabilize their housing for at least 2 years. I want to talk a little bit about experiences during homelessness. And one thing that I really want to highlight is that the experience of homelessness is not a static one, it's a dynamic one. People move in and out of spaces. in and out of different spaces, whether they be unsheltered settings, sheltered settings. 78% of our participants were most often living in an unsheltered setting in the past 6 months prior to when we interviewed them. 21% indicated that they were living in a vehicle most often, and 57% indicated that they were living in a non-vehicle unsheltered locations such as an encampment or somewhere else that's not meant for human habitation. 22% of our participants were sheltered. We asked this question in a variety of different ways. We asked where you spent the last night. We asked where you spent the most in the last 6 months. With regard to kind of unsheltered settings, 90% of our participants spent at least one night in an unsheltered setting during their current episode of homelessness. The physical health status of our participants was remarkably poor. So 45% of our participants reported fair or poor health. It's a self-reported question that often is an indicator of kind of mortality or future hospitalization. And to give a comparison to kind of the general population, it's about 14% in the general population who indicate that they have fair or poor health. 60% of our participants had at least one chronic health condition. 34% reported a challenge with at least one activity of daily living or a self-care task, such as dressing yourself or walking across a room. And finally, 26% of our female participants who were under the age of 45 were pregnant at some point during this current episode. 8% of participants were pregnant during the day that we surveyed them. There was pretty high levels of coverage for health insurance. So 83% of our participants were covered by some form of health insurance, most commonly Medi-Cal. I think it's important to note that we were in the field from November 2021 to October 2022 during a time of kind of relaxed enrollment criteria for many of these social services and benefits that we'll talk about today. 52% reported having a regular source of non-emergency department healthcare. And 61% said that they saw a healthcare provider outside of the emergency department in the past year. With regard to kind of acute healthcare utilization, so emergency department use and the like, 38% of our participants visited the ED in the last 6 months. And as a point of comparison, if you look at the general population, 22% of individuals visit the emergency department, but that's over the course of a year. So this is strikingly high, given that it's just 6 months. 21% had an inpatient hospitalization in the last 6 months. Again, this number is strikingly higher than what you see in the general population as well. So we talked a little bit about kind of lifetime experiences of mental health in the first section. I want to talk a little bit about mental health during the current episode of homelessness. So 66% of our participants indicated experiencing one or more of the mental health conditions that we list here. And again, this is primarily driven by anxiety and depression. 51% indicated kind of severe anxiety, 48% indicated severe depression, 37% indicated trouble remembering, understanding, or concentrating, and 12% experienced hallucinations during this current episode of homelessness. I think it's also important to note that homelessness often limits engagement and treatment. And so 18% of all of our participants received either mental health counseling or medication in the past 30 days, in contrast to what we see in terms of like the mental health need that's strikingly low. With regard to substance use during the current episode, again, we asked about illicit substances and we asked about alcohol. With regard to illicit substances, 35% of our participants indicated that they had used any illicit substance 3 times a week or more. 31% indicated that that substance was amphetamines, 3% cocaine, 11% opioids, non-prescription opioids again. What I think is important to note is in our qualitative conversations with our participants, it really came out that using substances while experiencing homelessness was kind of for many people was a instrumental kind of safety driven thing, particularly with our methamphetamines. People reported using substances to kind of stay awake, keep alert of their surroundings at night. When especially our unsheltered participants talked a lot about this. With regard to heavy episodic alcohol use, or commonly known as binge drinking, 16% of our participants indicated that they engaged in that during the current episode of homelessness. 11% of our participants reported experiencing an overdose during the current episode of homelessness. And finally, going back to kind of the limited access to treatment, 1 in 5 participants who reported current regular illicit drug use or heavy episodic alcohol use indicated that they wanted treatment but weren't able to access it during that time. We saw pretty high levels of incarceration during the current episode of homelessness. So 30% of our participants went to jail during their current episode of homelessness. And we also saw pretty high rates of violence experienced during homelessness. What I think is important to note here is that violence experienced before homelessness was typically kind of perpetrated by someone that the participant knew. But when we talked to participants about the violence experienced during the current episode of homelessness, they often said that violence was enacted upon them by a stranger. Pretty lengthy disconnections from the labor market, both kind of informal and formal labor markets for many people experiencing homelessness. 70% of our participants indicated that they hadn't worked 20 hours a week or more in the past 2 years. However, 44% of our participants indicated that they were actively looking for work. And when we kind of restrict the sample just to those who were under 62, so working age and without a physical disability, 55% of those individuals indicated that they were looking for work. With regard to benefits, we saw pretty high rates of enrollment in CalFresh, but we saw pretty low levels of income benefits or utilization of income benefits such as SSI, SSDI. And finally, I want to pivot to talking a little bit about barriers and facilitators of returns to housing. So we were hard pressed to find anyone who wasn't interested in kind of exiting homelessness and entering permanent housing. And when we talked to people, nearly all participants indicated that high housing costs were a barrier to them exiting homelessness. 53% indicated having a lack of housing relevant documents such as state issued identification cards as a barrier. Half of our participants also talked about extended wait lists, so waiting either for a housing voucher, waiting either for accessing housing. About half of our participants indicated that was a barrier. 51% indicated that their family or their friends were not able to have them live with them, and that was a barrier for them exiting homelessness. And about half of our participants also indicated that credit history or prior evictions presented a barrier to them exiting. Discrimination, whether it be identity-based discrimination or homelessness or housing status discrimination, 43% indicated that that was a barrier that they faced when trying to obtain housing. 36% indicated that a carceral record was a barrier. Mental health and substance use, 29% indicated that that was a barrier for them exiting homelessness. And then 24% indicated that a physical disability presented a barrier to them exiting. With regard to support finding housing during the current episode of homelessness, 2/3 of our participants also indicated that not having someone help them find housing was a barrier to them exiting homelessness. About half of our participants, so actually a little bit less than half, received formal assistance finding housing during the current episode of homelessness, but that housing assistance was pretty infrequent. So about 26% or a quarter of our participants received help finding housing either monthly or more frequently in the past 6 months. And most often our sheltered participants reported receiving help in that kind of past 6-month period compared to our folks that were unsheltered. So about 20% of our unsheltered folks did. And finally, we also engaged our participants in another kind of parallel thought experiment, but this time we were interested in understanding what they thought would help them exit homelessness, rather than kind of the prevention thought experiment that we engaged them with before. Again, we asked about this kind of monthly shallow subsidy. We asked about a one-time payment. We asked about rental assistance, such as a housing choice voucher. And then finally, we asked about housing navigation. 86% of our participants indicated that a monthly shallow subsidy would help them exit. 95% of our participants indicated that a one-time lump sum payment would help them exit. 96% indicated that a housing choice voucher would help them exit. Housing choice voucher or something similar. And then finally, 94% indicated that housing navigation, having someone help them actually find the housing, go through the application process, et cetera, would help them exit. And finally, in my last few minutes, I just want to spend a few minutes talking about some of the high-level policy recommendations. In the full report, we go into a lot more nuance, and there's more than just 6 recommendations, but I wanted to kind of focus some of the priority around these 6 that I have here. So really, the first being, we need to increase the access to housing that's affordable to extremely low-income households. Taking you back to the finding that we had around the median household income in that time before homelessness, $960. When you're also contributing more than half of that to rent, it's just an untenable situation. So thinking about ways to expand deep rental assistance expand rental assistance programs, expand kind of the usability and the reach of existing housing vouchers that are out there. But also thinking about production, right? So anything that we can do to incentivize housing production. We also talked to our participants about shared housing and how receptive they would be to kind of shared housing arrangements. They were open to it more so than, you know, kind of congregate shelters. However, I think they wanted kind of autonomy in who they lived with. So they wanted to make sure that they were compatible with who that they were living with to make sure that it was successful. And then finally, thinking about piloting monetary support to facilitate shared housing with family and friends, primarily because so many people entered homelessness from these kind of non-leaseholding situations where they're kind of informally listed, or they're not formally listed on a lease. We also want to think about expanding targeted homelessness prevention. And there are a few kind of suggested ways. Thinking about kind of engaging with folks in mainstream systems, whether they be healthcare settings, educational settings, et cetera, domestic violence settings, where people, extremely low income people are already kind of accessing services, integrating screening, integrating other kind of processes to kind of identify who might be at risk. And then also thinking about the fact that about 20% of our participants entered homelessness from an institutional setting. We know where those individuals are, and we can actually think about kind of targeting interventions to match the need of people that are exiting institutions to prevent homelessness, because we know that such a significant proportion of the population is entering from those systems. We need to think about matching the behavioral needs of the population. I make no illusions of the behavioral health needs of a significant portion of the population. It's not everyone experiencing homelessness. However, those who do have severe or complex behavioral health needs do need the support that matches what their need level is. We also need to think about kind of increasing household incomes through both employment and through benefit utilization. As we saw, there was pretty low benefit utilization, income-driven benefits utilization. And also there was these kind of lengthy disconnections from the labor market that we need to kind of close the gap on. And we also need to think about increasing outreach and service delivery to those who are outside, those who are experiencing particularly unsheltered homelessness. What we heard time and time again from our qualitative interviews was that particularly for unsheltered people, they just felt as though that there were no supports that were available for them. And so anything that we can do to meet people where they're at, to help support them in their journey back to permanent housing is what we should invest in. And then finally, you know, we kind of at the core of all of this is really thinking about embedding a racial equity approach in all aspects of homelessness system deliveries, from coordinated entry to service provision. And with that, I will yield to any questions that we have come up. Thank you.
All right, thank you. Very thorough and comprehensive. I can't imagine the other question.
Sure. Thank you so much. Really appreciate this. This has been a great conversation piece for a lot of us. We're trying to work on this. I'll direct my questions to my lane. So I'm in the criminal justice space as a district attorney. And one of the frustrating things for me is, because I've been doing this for over 30 years when I started, from my perspective, we've removed the incentives to get people. So for example, in the carceral setting, we had programs and we would exchange a dismissal, say, for example, a drug possession, in exchange for going through a program. We used to call it Penal Code Section 1000. Okay. When I read the actual lengthy report and you looked and you talk about your recommendations for people, it's starting on page 86. It's address the criminal justice system to homelessness cycle. We know we're turning people in and out. But at least in this county, we're really dedicated when we have a captive audience to try to get treatment. But you don't address that at all in the report. Like you talk about, and that's kind of, how come the report doesn't opine on the lack of incentives when we have people in a carceral system to getting treatment while we have them and they're doing their time? You talk about improve reentry to those exiting and reduce carceral responses to homelessness, but you don't weigh in on that issue. And I'm curious why, because a lot of us think that that was a very important hook, that we could give a dismissal so somebody could get back on their feet, but we made them do something and had very strict requirements with the oversight of court and a judge. We've had pretty good success with our homeless court here, but we have to have people do things and they have to know that there's consequences. I don't see anything in the report about that.
So I think one of the things that touched on that is kind of adherence to housing first. Right? So for us, but the research has borne out, not just the research that we've done, but the research kind of across the board. When you look at kind of the gold standard research on kind of behavioral health, particularly substance use and housing, is that you can't mandate treatment in terms of treatment first versus housing first. Housing first always wins out in terms of engagement with services and longevity in housing. And so my response is that it's really hard, especially when you're in the throes of addiction, to think about the negative consequences that might come later, because that's the nature of addiction. But however, when your housing is stabilized first, you're actually able to kind of think about engaging in services rather than kind of getting out of the survival kind of mechanism that we talked about earlier, the instrumental use when you're out on the streets. So my response to that would be, time and time again, really rigorous research has borne out that treatment first programs don't work in terms of kind of long-term efficacy, which is why our recommendations don't include that.
So if, just quick follow-up, if the research doesn't bear that out, and that's published places, I'm assuming you're an academic, then why are we local jurisdictions like us investing so much in those kinds of resources in our homeless courts, our drug courts? I mean, we spend a lot of time in that area. Are we just wasting our money?
I would say any program that insists that a participant engages in treatment mandatorily, that to me is a program that doesn't have evidence in support of kind of its success.
Okay, great. Thank you.
Our alternative courts are following. They are.
We have, are you talking about across the street?
In terms
We
of.
are hanging criminal charges over people's heads.
But ultimately you have it, am I right in that you have a choice to go down the traditional route or the?
One's jail and one's a program. I mean, yeah, you have a choice, but the idea is we're using the carrot stick to get people to change their behavior. And the legislature's taken a lot of that away from us in terms of like drug use is not a felony anymore. So we've had, if you look at drug court, the number of participants has dropped dramatically over time when basically drug possession was decriminalized. I'm just saying, like, look, if we have it wrong here in Orange County and the academic research doesn't substantiate everything we're doing and the amount of money we're investing in, then that needs to be a very major conversation as well.
The reason I asked the question is.
Essentially, I don't know if they're the exact same conversation is, I guess what I'm saying is the choice of going into, the choice of getting services out on the street compared to the choice when you're ultimately giving some type of a choice, whether they're two unattractive options. You're not necessarily forcing folks into treatment. You're saying if you want to, if you want to lower, or expunge, or you're better at explaining this than I am. But if you want to avoid jail time, you will go into a program. I'd argue that's still a choice. So, that's where my support behind it is.
Paul.
Hi, I have a few questions, and my background is scientific and engineering, so digging data. I appreciate, the data collection was fantastic, the amount of data. I noted at the beginning that you said that the state didn't pay for it, you found other funding. But I would like to ask, is the data available? Can we use it to match other data? Can we manipulate it in different ways? Is there any way to get our hands on data so we can leverage it in more settings?
That data, are you talking about like the raw data from the study? Yeah, we haven't decided yet to publish it publicly. And that's primarily out of respect because we have a lot of qualitative data that could be pretty identifiable of the individual that we talk to. But we do plan to release additional reports with more data that will hopefully be helpful.
Well, you start with the demographics and then you collect data and then you sum it by demographics of various sources. And there's hundreds of ways that you can sum it in order to try to to measure something or have on it based up a hypothesis. So, that's an endless stream that would be very helpful. And that's what I've been sort of pushing us in our internal data collection from, point in time counts and surveys to do also, so we could match these up and then, make some recommendation or make some hypotheses and then measure, right? So anyway, it would be wonderful. And if you could make it anonymous, I actually don't care about the individual, right? I care about a number of attributes of the individual, but I think it's worth looking into. I think the data is valuable and it's raw data that can be shared so we can build on it. The other thing related to that, I noticed at the very beginning, you said, as a scientist and academic yourself, that you're looking for evidence-based and actionable results. Your recommendations didn't tie back to the data. That is, I'm not saying you didn't tie the data back. I'm saying it didn't expose the ties. So if we took, for example, there's lots of actions here. Some take long calendar time, right, to implement. Some take a lot of money to implement, and the impact is various, and and so forth in the cost. So every time we want to make a trade-off, if we're looking to change a piece of data, right? If we think if we do this program, we can cause these numbers to change, then we need to sort of make that, and how soon can we cause them to change? That's really important, because some of these I think there are presented a number of things that could have a very short-term impact. And if we could do that, right, basically by changing some of these things that relate to prevention, that relate to, other short-term where you're, as opposed to building more houses, which is never quick in California, no matter what. But we would want to tie back and say, okay, this is the piece of data. Now, we think we could, if we altered this piece of data over, a 6-month horizon to a 1-year horizon, what would the end result be on, our overall homeless population? Could we prove that out? What would it cost? Right? But we need to tie it back to the data, because then we need to go remeasure, right? To say, did we change that data that we expected to change? So if you have sort of that bridge between the data, the raw data, and some of the evidence that we could use. So if we implemented some of these programs, we could remeasure, that would be fantastic. So.
Yeah, I think there, in the longer form report, we do try to kind of set like higher findings back to specific policy recommendation. And at brevity, I didn't kind of go into the nuances of that. But I do understand your point about being able to kind of look at data over time. One of the limitations of the study is that we just kind of did, we only have the resources to go into the field once. We don't have the resources to kind of go back out and do this again. But one of the things that we're really hoping to do is kind of continue the conversations with our county partner, to continue conversations with our state partners, give them the tools that we use in the field in order to kind of conduct similar kind of research that they might want to endeavor in. But your point is very well taken.
For example, here, we at least are inclined, and we just took our first step at it, to survey once a year. So if, so we can follow up on data when we have programs to say, okay, let's look at some of these programs. We expect this data, and we add that to our survey in our next year and remeasure, and then feed that data back into, an update to you and the presentation. I mean, we could update that. So right now, we're sort of inclined to do that. I think I'll get Doug's not yes or no, but he's supported it once anyway. So maybe as a commission, I think we're probably inclined to do that anyway. So we would want to go back and remeasure some of these points. So it wouldn't be, I understand the funding give you once, but we can provide at least on a narrower, a smaller set of data funding to do it more frequently, and therefore provide more data. That would be incredibly helpful, I think.
I agree.
I have a question about the information you had on victims of domestic violence, and specifically those that experience violence once they're homeless. I know you noted that you found 49% said the perpetrator was a stranger. I'm curious if you were able to note how many were fled and ended up homeless and then also were re-victimized? Because we see that as a pretty consistent pattern, and whether you captured that information or not.
Yeah, with regard to intimate partners, while experiencing homelessness, I believe, if we're, I can look at the stat for, sexual violence, I believe it's 10% of people indicated that they had experienced sexual violence during the current episode. I believe it was 49 or somewhere in about half of folks indicated that it was perpetrated by a stranger. And I believe it was about 20% or so of individuals indicated that, of those 10% indicated that it was by an intimate partner. And we don't really have the clarity on whether or not that it was an intimate partner that they were currently with still, or if it was an intimate partner that they fled and then re-encountered while experiencing homelessness. Mhm.
Dr. Moore, thank you very much. Terrific presentation. I just had a question about the pathways to homelessness section and wondered if you had any insight that you could offer regarding prevention strategies based on what you saw in the data regarding particularly slide 24, which talks about median household income versus median focus. What I think I heard you imply or state directly before was that you saw a trend in the population, looking at the data, that people essentially began to go down through the housing matrix, if you want to call it that, from perhaps more stable housing to less stable housing. So it wasn't like a complete drop through, through the floor, that there was a pathway. And did you have any thoughts? I mean, kind of like the district attorney's question, any thoughts about or insights for the commission responsibilities of homelessness?
Yeah.
About what we might not see, or what I think there's a less profound, robust set of data about prevention strategies than there is about permanent supportive housing and housing first issues. That's a well-studied enterprise, but I think prevention is a less robust information set.
Right. So there were there are multiple pathways to experiencing homelessness. We often heard from some of our participants that they had a stable housing situation, a life event happened, whether it be a health event, whether it be an economic shock, whether it be something that's going on in their life that allowed them to, or forced them out of their more stable housing and caused them to kind of steadily go into these less kind of ideal and less stable housing arrangements, ultimately until they entered homelessness. I would say with regard to prevention, what I've seen across the board is really thinking about kind of using local data to drive prevention efforts. So thinking about using your own community data, whether it be data that you're accessing through HMIS, to think about kind of who experiences homelessness and how can we kind of go back upstream to think about supports that are more tailored to those individuals. So with regard to prevention, I don't think there's a universal answer that I have for you, unfortunately. I think it's very kind of locally driven and kind of follows what the county level data says about who's experiencing homelessness in your current population. I will say that what research is also borne out is that, if one of the highest predictors of experiencing homelessness again is previous experience of homelessness. And so that's a very kind of critical and a very kind of clear area to kind of target prevention to. But also I would say local data systems can really help drive the conversation around how to target prevention.
Let me ask a couple questions real quick. First of all, you mentioned that the counties you were dealing with are confidential. You're not going to tell us which, okay. Why?
Yeah.
Because San Francisco is different than Orange County, is different than El Dorado County. Can't we tease from the data certain things that may not be working here or causes that may be in play over there?
So each particular county that we surveyed stood in for a region, right? So a collection of counties. We use an amalgamation of data from across those counties to find to have a representative sample within that particular county. Part of the reason that we don't disclose which counties are participating, it's kind of twofold, right? We wanted our county partners to be partners with us in kind of our on the ground efforts. We also didn't want anyone to feel like the problem is not a problem in their particular area, right? So if you say we were in Los Angeles County, we didn't want people to kind of understand that it's a Los Angeles problem only and not something that's kind of universal across the state. So those are kind of the twofold reasons that we kept things anonymous.
But I don't think we're asking that. It's not like it's not a problem throughout the state or throughout a region. It's just that the problem in San Francisco, the mix of folks that are homeless, the reasons why those folks are homeless might be very different for what do you call it, the Outer Bay Area, than El Dorado or Stanislaus. Different reasons why people are homeless, different mix of homeless that might be relevant. Couldn't it be?
I understand that point. I think, at the end of the day, the goal of the study was really to produce statewide estimates to help inform kind of policy efforts by painting a picture of what's going on across the state rather than kind of looking at particular counties or particular regions. I totally understand your point. I just want to say the goal of the study was to produce statewide estimates.
So the picture you're painting of Orange County, you think is fair and applies also to Shasta County?
I would say that we use sample weighting so that it is representative of the state as a whole.
Next question, the slide about last housed was the phrase. Was interesting to me. One of the things that I thought, and we talked about this when the report first came out, that surprised me is the number of homegrown homeless reported out of this study. But that isn't exactly what the slide says. So what does last housed mean? Because maybe I'll believe that folks aren't homeless in Minneapolis and say, gee, it's cold, I'm gonna go be homeless in Santa Monica. It's just, well, California has all kinds of benefits and does all kinds of other things, or I'd like to go do smash and grabs, and here in Kansas, they'll throw me in jail and they won't in California. So I'm gonna go to California. And then I end up homeless. That's not a homegrown homeless person. What does last house mean, and how do I tease relevant information out of that?
Last house in this particular study is your last stable housing. And I think what helps give context to this is when thinking about housing tenure, how long a participant lived in that housing before. One of the kind of limitations of the study is that we don't have the information of where they were before their last stable housing, and people might have kind of lived in a different part of California before, but we don't have that kind of information from this study. But what I will say is that 90% of our participants were last housed in California. The median tenure in that housing for all participants was 1 year. If you look across our participants who were leaseholders, it was 3 years in that last housing, and it was 1 year for our non-leaseholders. Importantly, also, in terms of kind of the homegrown problem that you mentioned, when we think about kind of where people were born, right? California, about 68% of our participants were born in California. But when you look at we have 90% of people who were last housed in California, 10% were not. Of that 10%, 30% were born in California and came back. Oftentimes what we heard from the qualitative interviews was that they thought they were able to live with their relative, and thought they were able to live with their friend, and then something fell apart and they were unable to anymore. So 90% last stable housing was in California. Median tenure within that housing was 1 year for everyone, 3 years for leaseholders. And of that 10% that were not last housed in California, 30% were born.
All right, thank you.
Sorry.
Hang on, Commissioner Tremaine.
Thank you, Dr. Moore, for not only presenting, but also fielding some very interesting, difficult questions. I think that's the benefit of having somebody, who's co-authored this, because reading it on the four corners of a policy report sometimes doesn't tell the story. The background that you give really highlights some of the things that are important, I think, for this commission, and really any policymaker and anybody that cares about this issue, like everybody here at the table. For me, I think it's fascinating because it confirms some of the theories that we have, but it also highlights some things that maybe are more counterintuitive, right? I do think that for me, knowing that 90% of those who are unhoused are our neighbors, right, and are here from California. For somebody to come here from out of state, what I always thought is, yeah, the weather. I never thought somebody would be drawn here because of the lax, law enforcement. That's just not something. I think that takes a lot more thought for somebody who's going through crisis and trauma. But I do think this county should be proud of what it's done. So I don't want to send you away or in my opinion, even tell this commission, there's a lot of things that we're doing right because we're one of the few counties that has had a reduction in the point in time count. And I know that's something that we don't talk a lot about because we are doing things that work. And I know that last meeting, I think, Sue and her team from United Way presented on their survey and their findings which were pretty consistent with what you're sharing with us. And I know, this commission has commissioned our own survey that we're going to do, and hopefully that's going to be layered on to even a more micro level. But, what I wanted to talk about, and I guess I have a question that is pretty broad in and how you mentioned certain indicia of mental illness, substance abuse, those that are unhoused. The sequence to me is really fascinating, right? Does somebody become unhoused because they're using, an illegal substance? Does somebody become unhoused because they're mentally ill? Or do you become unhoused because of a rental or, a financial factor? And then you fall into homelessness, you fall into crisis and trauma, you start trying to self-medicate, folks prey on you, and then your mental health just starts decaying. So to me, that's something that may be a pretty broad, speculative way of looking at this, but that's kind of the way I see, like, where does the origin of homelessness begin? So I won't have you answer that, but those are just things that I think, we can all kind of speculate. What I do want to kind of focus on is, this commission, I'm trying to figure out what we do, quite honestly. And I think it's to come up with policy directions, right? And so I think looking at some of the things that are common denominators from all, counties in your survey, and this is a pretty comprehensive, broad survey. I don't think, as you said, something this deep has been done in a very long time. But I think your first 2 points on the policy recommendations are part of our our 4 pillars here of this commission. And I think we've done a great job in shelter, congregate housing, because I remember, when I first was a city council member years ago in Santa Ana, there was like one shelter, right? Now there's a network of places that we can take folks, in congregate housing. But, and our outreach and support services, I think, are strong. But I think where we are sort of teetering on, where do we place our efforts, right? Is it housing? Is it prevention? And I think it's both, because you have them see, and I don't think this is in priority order, but I think the prevention to, I think, George's point, I think was something that we haven't really dug deep into. And I think that it's only going to get worse with pandemic relief going away. Folks are going to start seeing this more. They've been housed for the past couple of years because of this support. It's going to start growing. So if we can, Doug, I would say, let's just talk about, prevention and how do we focus in on some of those efforts? Because that is the one consistent theme that I think on interventions, you have people responding into the 80s and 90s, saying that that's something that would have been really helpful. But on housing, I think that, we've had the discussion here, the cost and the time it takes to just build out a brick and mortar, unit for somebody is really expensive and extensive amount of time. And people are going to be just becoming more homeless during that period of time. So maybe we can look at ways that you do, manufactured housing, something that's much less expensive, something that's much easier to build up and build out. And looking at counties that have, and cities that have done this, and which ones have done it well. And so, even though I think we're strong, we're a strong county. If you look at our peer counties like San Diego, they're going through some real challenges. LA, that's an entire different animal, but I think for us, if we can, dig down deep into these 2 pillars, I think it would be it's a solvable, manageable problem. It's not out of control. And I think that that's something that, this commission could really pride itself on, is coming up with some good, advisory direction to see how we can continue having that success. But, anything on prevention, I guess that.
Many great points on what you shared. I will say with regard to kind of the delays in housing production, we're all aware that the time, the cost, kind of the local zoning requirements, all of those things are. What I will say is one of the kind of a couple of the recommendations that we have are exploring ways to kind of creatively use the existing housing stock that we have, whether it be through exploring shared housing arrangements and expanding that once kind of explored in making sure that it's in alignment with giving individuals autonomy, in alignment with making sure that people are living with individuals who they're compatible with, thinking about ways to kind of use the existing housing stock, whether it be through projects like Home Key to kind of convert existing buildings into like permanent housing for individuals, thinking about ways to stabilize people in the housing that they're in as well. Anything that we can do to protect their ability to live in that housing unit, I think we should invest all in on. Particularly, I think the finding that's coming to mind when I talk about that is the fact that 43% of our non-leaseholders weren't paying rent in their last housing arrangement. And oftentimes what came up through our qualitative interviews is that the non-contribution was a source of tension within the household, which caused them to kind of lose their housing arrangement. So thinking about ways to allow flexibility of existing subsidies to be used in kind of those familial situations in which someone has housing, and anything that we can do to kind of protect and keep them housed is what we should kind of invest in. So those are some initial thoughts. You raised amazing points, and I think we wholeheartedly agree. It's just a matter of being creative with our resources that we have at hand that are more expeditious than creating housing.
So just last point, so this is an identifiable group because I think you said many of them were, institutional, sort of the institutional information, whether it be through healthcare, education, and I think education, the McKinney-Vento could identify those without disclosing any confidentiality on them. Folks who were formerly, victims of domestic violence. So these are identifiable folks that we know are probably very close or on the precipice of becoming unhoused that we could, get some help to, because that's always the challenge. How do you find the right demographic? And we know it's an elderly population. It's probably single mothers that probably are much more vulnerable. But listen, thank you for the comments.
Commissioner Fobley and then Commissioner Parks.
Thank you, Mr. Chairman. Moore, thank you for joining us today. Appreciate that. I'd like to speak to the commission, and maybe have a bit of a solution mindset. One of the interesting, I think, significant characteristics of the group that was studied is that 83% are covered by Medi-Cal. I don't think of Medi-Cal as health insurance. I think of it as a platform for care. But it could be a platform for more than healthcare. In fact, remember when Kelly Bruno was here and spoke to us about CalAIM, which is a new design to how Medi-Cal dollars are going to be utilized. She works in CalOptima, which is a county organization which has oversight by the supervisors. And she spoke to us about housing, and she spoke to us about a host of social programs. And she talked about street medicine, which is different than insurance, very different than insurance. So speaking to the commission, I would wonder about whether some sort of intervention pilot could be considered using CalOptima, which is, we're a single payer county. We only have one Medi-Cal program in Orange County, only one of 8, I think, in the state that has that. And it's a county-run organization. So if we can think about CalOptima as a platform, if we can think about it, and oh, by the way, I did want to mention as well, think about the confluence of mental health, physical health, substance use disorders, and how those all are confluent, if you will. And there already are those pieces in place within the CalOptima system itself, but also the delegated groups that it works with, including hospitals and physicians. I think it's a unique opportunity. This tells us that if it's 83% in this study, it's probably 83% of our 3,000 or 4,000 or 5,000 homeless. They are going to have a high percentage of accessibility and also contact capabilities with that platform. Maybe we could think about CalOptima as a way to have some form of intervention to really get into what next after this study tells us that we do.
What is the next step to get Cal doing that?
I think it would, go ahead.
Doug?
I know what I would say.
Well, I know, and I think I see Kelly in here, somewhere there you are.
Hi, Kelly, didn't know you were here.
So there are a tremendous amount of conversations happening both at the county with Kelly I know that we have some conversations happening around prevention and how Cal Optima, specifically Cal E, might be able to support that. We're working with Cal Optima. I know our Dr. Kelly and Deborah Bates are working very closely with Cal Optima around how to ensure that folks are getting the behavioral health services and substance use services that they need. And then obviously, we have an action item on the agenda today to potentially bring aboard a representative from essentially Cal Optima. It's asking for the Medicaid managed care plan representative to really talk about it. Cal Optima has invested a tremendous amount. I believe it's the RFP is still open, right? Or it's about to close around funding through HHIP. It closed yesterday. So, yeah, there's tremendous amount of discussion, and not that I want to, put out any spoiler for next, but some of the data that we do already have state here in the county, I think the number is actually 83% report as well, like 83 on the dot report here in Orange County out of the 600 plus we surveyed have health insurance as well. I found that very interesting. So, yeah, it's incredibly important in the work that we do in the Office of Care Coordination at the county, understanding that funding's so limited that, as you put it, Dr. Afable, that CalAIM is a platform both for services, but I'd argue a platform for funding as well. So, and ways to financially support programs.
Thank you.
Rich Parks.
And Dr. Morgan, thank you. And it actually does definitely I love the idea in terms of prevention, like everybody that needs to speak out to think about how we can come out, right? And so whatever we can do in that way, I think that's a responsibility for in that. Maybe we can learn that. I don't know. And about in this year, go by housing authority or not, because I think I love the idea they're limited in housing stock. How do we, and people are open to that, which I've also heard, how do we make that happen? As a policy training,
Yeah, I'm not going to put Julia Bizzle on the spot, but I know there are scenarios, right, Julia, where you're able to utilize a voucher through shared housing.
So is that a commonly used practice? Is there something that we could do more of?
It is something we could do more of. I thought it was interesting because throughout my career, both working here and back in New York, where New York City is incredibly in the same sort of housing crisis with limited units. And often the question is about, well, what about shared housing? What about shared housing? And I appreciated the additional context that was provided with this survey, which spoke about people's interest in it, but the importance of that autonomy around selection of who's going to be that person. So, I see when I look at this study and obviously and think about this particular study, and I think we can see there's some overlap, as we know, with our study coming out in 2 months. But I believe what Supervisor Sarmiento mentioned is if you look at it from a high level, because we could, a lot of the stuff in here is really interesting. You can drill down on some of the findings. To Chairman Wagner's point as well, is that this was conducted in 8 different counties. So it is a representative sample of the state, but at the same point, like if it wasn't in Orange County, everything's unique. But so thinking about that, looking at the very high level recommendations, the 6 recommendations, and they align with not only the way we structure a conversation here with our pillars, housing, prevention, employment, outreach, supportive services, but also ultimately the larger system that the county and the county with a big C and the county with a small c has developed it. And really thinking about, my thoughts are, okay, what areas do we want to look in where we feel like we're not doing as much? But what I see here is that the report says a dynamic balanced system is important, and that there's no one silver bullet intervention that we just need to hone in on. And that both includes the balance of financial and benefit need, but also understanding the the challenges that people have with behavioral health, substance use, and how intertwined they are, and how the importance of a dynamic system. So yeah, that's what excites me about this particular study and what I take from it.
Mr. Spitzer and then Mr. Wyatt.
So if I could dovetail, I'm not sure on this voucher thing if I'm in the same space, but I want to explore something because on the key barriers to return to housing on page 42 of your PowerPoint and then on page 81 of the board, you call it family friends not able to have participant live with them, 51%. In the takeaway, it just says family considerations. I have to tell you right now, if my kid lost his job, my wife and I would take him in 2 seconds. I think the government is taking on too big a responsibility. I think the families have a lot of responsibility. We have a model with in-home supportive services where younger people are taking care of their parents in a house. And so my question to you is, what did you find out? Because I have a cousin, we think he's no longer living. My aunt and uncle, he was a drug addict. They tried to save him. And at some point he was stealing and it was impossible. And they had to just kick him to the curb. And we don't even know to this day if he's alive. Those are two models. I'll take my kids in a heartbeat. Other people cannot take their kids in or their loved ones. But if we're going to have a better housing model, like a less expensive, already stable, solidified structure, the better model is something that already exists, right? Than something we have to build. So that's not really explored. What are the greatest barriers? Is it they can't afford it, they don't have space, or they just can't tolerate the person who's in that situation because they can't take on any more of their afflictions?
I think it's a little bit of all in some ways, right? So when thinking about the first one in terms of space,
typically our participants were coming from kind of situations in which they were not making a ton of money, and probably their familial connections also were limited income as well. And so taking on that additional space when they probably don't have the space to begin with is very hard. Secondarily, what we heard kind of loud and clear through our qualitative interviews was kind of a desire from, sorry, I lost my train of thought. From our qualitative interviews, what we heard was, conflict arose because individuals weren't contributing to rent or didn't have the ability to contribute to rent, even though they were living with friends or family. And then, what we also heard through some of our qualitative interviews that, my substance use or my mental health conditions makes it very hard for me to kind of live in these spaces. And so I don't think that there's a single answer to your question. It's a little bit of a mix of all three. But what we heard predominantly was more of conflict arising because they weren't able to financially contribute, more so than my substance use or mental health challenges or space constraints were the reasons that drove my inability to live with my family and friends.
So I know that when we send people away from our county, sometimes to a different state, we try to, if their family's willing to take them, we do whatever it takes, right? Plane, bus, whatever, we'll send them back because that's probably the most cost-effective way. Should we be exploring that more in depth with financial support for the existing family? If you're saying the barrier isn't necessarily mental health or substance abuse, it's more financial. I mean, to me, that on its face, that seems to be way more cost effective and more stable to be returned back to your family structure where maybe you'll have a stronger sense of support. I mean, when we had a homeless issue years ago and we put homeless into temporary shelters like hotels and things, they destroyed those promises. Okay, they weren't, in my opinion, they weren't ready for housing. They had too many other issues. So do you have an opinion? I mean, what is the research showing in that regard?
in regard to kind of
To sending them, to try to place people back in a structure of a familial setting.
Yeah, I would say that's a small subset of individuals too, right? When we think about targeted prevention, it's not a program that's going to work for everyone. It's a program that's going to work for those individual people that have that particular situation that they're navigating. So that would be my response, is that we have to think about ways to target programs. There's not going to be kind of an overall one program that's a magic bullet. It's
That's what he was.
yeah, it's thinking about how to tailor programs and how to be flexible with programs enough to meet individuals where in the situation that they're at.
But if 51% are in that category according to your study,
Yeah.
what percentage of the 51% were families that would be accepting if there was not a financial barrier?
I should
Is
also-
it 25%?
So there's a couple of things. These are barriers, any barrier, right? So it could also be, people can indicate multiple, right? So 51% of individuals said that that's one barrier that they're facing, but 89% of individuals said that the housing costs are the primary barrier that they're facing in kind of regaining housing. So I would take that into consideration as well. It's often not one single reason that people kind of experience in terms of barriers to returning to housing. It's often a very kind of interconnected web of things. And so that would be my thought, is that, yeah, 51% did say that this is a barrier for them, but that's just one barrier that they're facing. And there's also multiple ways to support them as they navigate other barriers as well.
Ms. Wright.
So a couple, one to I had a response about, prevention early, in that one of the difficulties we have in prevention, and Commissioner Parks and I talked about this a few years ago, and they started a program, which is basically you can't prevent something that you don't know is about to happen, right? So, and this generally aren't things that people just go out to anybody about. So it's often embarrassing. It's something that you would tell somebody who's close to you about, maybe, but you wouldn't tell just anyone about. So trying to break down that wall and find out. And so in that particular case, Mr. Parks said, well, our grade school teachers and staff always know when there's a problem with those students. So that was a starting point. But Dr. Fable's comment about Caloptima also, and records here, sorry. That's also an organization that interacts with people in an environment where potentially could have that conversation. Where you wouldn't have it with just anyone, but if you were in a supportive environment where you got help already for a variety of things, then those flags are there, and then being able to have a conversation with somebody that you're dealing with, that would be an important one that we could look at a program to say, could we at least make it easy and comfortable for somebody to tell you about, they're at risk of homelessness because of a job loss or an expense or whatever, and then be able to initiate programs out of that, because we need that initial contact point. I think our senior centers are another place where we're dealing with senior meals and get together, because we're getting older, homelessness on the street, and there's a familiar thing. So I think when you looked about programs we might bring up, we have settings where we have people in a comfortable environment where they're used to talking to others around them, where we could raise the discussion about at risk and do that. And I think we should look into every one of those programs where we get people in an environment where they're comfortable enough to talk, and we shouldn't pass that up. I mean, the number here that only 8% of the people seeking help went to government is scary, right? I mean, basically, that shouldn't happen, right? I mean, I think our city should take the lead of putting together programs that make it comfortable to feel like you can reach out to the city. But I think ultimately there's a real in-place environment today. We should try to go out and use it.
Absolutely, and I wholeheartedly agree. That's one of our recommendations. It's really harnessing the power of the existing systems that people are accessing, and either providing resources, doing screening so that we actually know who's on the verge of experiencing homelessness to target prevention efforts.
And then the other thing in terms of coming back and relates a little bit to what Commissioner Spitzer was talking about earlier, but in your recommendations, as you said, we cannot dictate plans and pathways out of homelessness. It never worked. It won't work now to tell them, well, you gotta do this before you can do this, and if you don't do this, you won't. But we don't have a recommendation in there for programs that work with the individual to create their own pathway out, where, you know, you create a realistic pathway that's theirs to drive, and you know, and we're the support organization, not the driver. I think that we should look into, or at least programs, or maybe you've done some work in programs where we're putting a great deal of effort in to develop the competence and knowledge that they need, and hope, I guess, to create a plan, and what role we play in supporting them as they do it, but put them in the driver's seat. That's a recommendation that I don't know what you've looked at or why I didn't see it, but that I think we need.
Yeah, I think that falls under a recommendation around housing navigation support, case management support. We recognize that,
Especially when we get to the numbers around kind of frequent communication with the housing navigator, particularly for our unsheltered folks, those numbers are so low. 20% communicated with the 20% of our unsheltered participants communicated with the housing navigator either monthly or more frequently in that 6-month period prior to us interviewing. And so anything that we can do to increase outreach and personalize outreach. But I will also say that, you know, one of the things that came up through both our quantitative and our qualitative data was really the challenges in maintaining contact with that individual and like spending time in developing that plan, because oftentimes, as I mentioned, you know, homelessness is a dynamic situation. It's not static for someone. So they might be at this encampment today, but you know, tomorrow they might be somewhere else, or they might not have access to a cell phone anymore where you can contact them. So I think both kind of thinking about engagement more frequently, but also thinking about what you can do in the immediate term for that individual when you make that first point of contact is really crucial as well.
I think there is a need for constant contact, right? Repeated contact, right? I mean, you know, we set up a program in our setting. We're not very big, so you know, it's may not work, but we meet every week and go through everybody that we know about, and then we try to make contact at least twice a week, right? Because and somebody who's got a consistent contact they're familiar with, because it's that continual contact that allows you to actually create the environment that you can then do something from. I think those programs will be important, that kind of program.
All right. It's 2:30. We've got a couple more agenda items, so if we could wrap this up. Anybody else? All right, Dr. Moore, a lot of food for thought and a lot of food for conversation. So thank you, and we will appreciate it and come back to the issue, I'm sure. All right, we are at item 3. Madam Clerk, if you would read.
Item 3 is to approve the Commission on Homelessness minutes from the June 21st, 2023 regular meeting. We have no requests from the public to speak on this.
All right, any comments? I'll entertain a motion.
So moved.
Is there a second? Moved and seconded. Any opposition or abstentions? With one abstention, the matter carries unanimously. Item 4, please.
Item 4 is to approve the cold weather emergency shelter ad hoc recommendations, including A, the Commission to End Homelessness to send a formal letter to mayors of all 34 cities in Orange County to explore options for cold weather emergency shelter programs in their cities, and B, to examine the county, cities, and contracted street outreach providers' policies and procedures related to extreme weather event preparation and response beyond cold weather, and create a set of recommended policies and procedures to incorporate best practices in alignment with the Homeless Services Code. And we have no request to speak on this item.
All right, let me turn this to Mr. Beck. Floor is yours.
Absolutely, thank you so much. So as you all may recall, last meeting, the commission approved the creation of an ad hoc group to discuss the challenges that we've had in the past and the potential future models of a cold weather shelter moving forward, specifically in this upcoming cold weather season. The ad hoc group, which consisted of several commission members, including Supervisor Sarmiento, City Manager Jim Vanderpool, City Manager Deborah Rose, Captain Ivins, and also joined by our County Executive Officer Frank Kim. During the ad hoc meeting in early August, the discussion centered around the feedback we received from the 2 cities that have previously hosted the shelter, specifically Santa Ana and Fullerton. And what we've heard from both of those cities is that they've always, that they're proud and of their support and their participation in supporting the cold weather shelter, but they've experienced significant impacts from hosting a large centralized cold weather shelter that has been in charge of essentially serving the entire county. And ultimately that they're not supportive of hosting a similar large site model in their city this current year. Additionally, worth noting is that last year, as many of you know, we ran an RFP to, as we traditionally do, to solicit a potential provider, a city, to get respondents around our model, our cold weather shelter services. We did not receive any formal responses to that RFP. And we did not hear from any city that they were interested in hosting the site until Fullerton, we so graciously appreciate, stood up in December and said that they would be willing to host it. But we did hear from a handful of cities stating that although they were not interested in it hosting a large centralized site, that they were willing to talk about or lean in to a potentially smaller, more city or community-focused site. So the ad hoc discussed how a potential model in which there was multiple smaller sites throughout the county that collectively produced the same capacity as the historically larger central sites might allow for each site to serve the proportionate need of that city or community might be of interest. The smaller city community-based sites would not only allow for lower capacity, as I mentioned, but also increase the chances that the sites were serving the people from that local community. The county additionally is open to utilizing the limited funding that we have, that we've traditionally used to fund a larger centralized site to assist cities in these smaller sites. With that being said, the ad hoc is proposing and as a recommendation of sending out a formal letter to all 34 city mayors to engage and explore the interest in potentially operating a smaller site in their city. So I guess I'll pause there and invite any of the ad hoc members, if so interested, to jump in and add any additional context or feedback that I might have missed.
Go ahead. Sure. Yeah, I think I'm the only ad hoc member here. I'm not sure who else was on there.
Yeah,
Deborah.
Yep.
So I think the conversation was a really good one. I think the city manager from Anaheim was helpful, and we try to put everything into context because I know, with Chief Dunn kind of explained some of the challenges that they saw in Fullerton this last time around when they stepped up at the last moment. And, I personally and intimately know, and as does, City Manager Ridge, the impacts to Santa Ana. But I think the idea was, I think when we were discussing is, there were some transportation challenges that we saw because having one, cold weather shelter. And I think, we were struggling even with that term cold weather. We now know these are, weather impacts, not just folks who are unhoused during the winter season or during cold weather, but during really hot weather as well. So it's any extreme weather condition I think that you need to start looking at that these spaces may be available for. But the idea was to have more of a shared responsibility. And, we talked about maybe rotating this responsibility amongst the different cities, but that becomes onerous on that city who's hosting for that year for the reasons, Fullerton knows and the reasons Santa Ana knows. But having everybody now do sort of a small share of this through the network of shelters and maybe other sites that cities may have, maybe a little easier and maybe more accessible for those, right? So if somebody is in, the central spot, northern spot, or southern, they can kind of go to their nearest place as opposed to transporting them, to some place that's far from where they are. But that was sort of the hope, is that, this would encourage others. It'll be much lesser of an impact on maybe some of the cities that host these shelters. So they would maybe set aside 10 to 12 beds, lower the barrier at their shelters and allow for that during extreme weather conditions. So that was the idea, and we're hoping that, you know, other cities will see that as sort of a small sacrifice that they make versus one city having to shoulder the entire responsibility for that season. But that's something, I think that was the rationale that maybe got us to that point to make this, to recommend this to the full commission.
Follow up?
That's a great rationale. It just hasn't ever been successful in this county, in South County in particular, which I represented for many years on the board. I mean, South County's not doing its share. And Santa Ana and Fullerton and, you know, and look, I think the northern spa is doing amazing. I mean, Placentia, there's cities who have really, Anaheim, there are cities who have really stepped up to take responsibility. And it hasn't been proportional. My question just on your recommendation, and I appreciate the work, why not go to the spas as opposed to the mayors and make it a collective like initiative? In other words, hey, we're asking you as the regional spas to come back and tell us how you would deal with this issue in your spa region collectively. Because that emphasizes it's not an individual city. And I think some cities are like, hell no, right? I've seen it firsthand many times. Versus the spas understanding that they have a responsibility, but a lower one, but make it more regional. Did you all debate that or talk about?
Yeah, and I think there are some, you know, already some of the shelters that are region, right? So you look at Westminster, you know, Garden Grove and Fountain Valley. And, you know, you have Newport and Costa Mesa. So there are, you know, these regional solutions, I think, and that's really the idea, is not to overload one city and just to say, look, can we all figure out amongst all of us, right? But to the extent we encourage, so maybe there's a city in the South Spa that may say, we don't want to open up an entire shelter, but for a temporary finite period of time, we're going to make 10 beds available. Maybe that'll invite them into finally the space, realizing the impact is lower. But our frustration was exactly that. Not everybody is stepping up like some have, right? And that's the idea, is that now with the cold weather, you know, I think we're looking at November, right? We're already, you know, in August and this time is going to be upon us. And then we're going to have to be making really, you know, leaning on, you know, one city, which I don't think is the best way to solve this problem. But I think, yeah, if it's a regional versus an individual city, that, you know, 3 cities get together and say, look, we can go ahead and step up and we
So
want
would you
help.
be willing in the recommendation to send it to the mayors, but then also send it to the regional?
In
Kind
addition
of
to
the
that,
collective in addition?
I don't think there's anything, I mean, I don't know if it'll
A
be.
region.
Who would you get?
Yeah.
Well, it's the cities within that spa.
Anyway.
I know, but I don't know.
I don't know.
You get a letter as a mayor, you feel like this is onerous burden on you. Versus, hey, you're part of a region and we're asking your region as recognized by our geographical designations that exist today. To get together and talk about your collective approach as you. In other words, why do we have spas if we're just gonna throw it to the mayors? It's not, I don't know, 6 half dozen another, maybe, I don't know.
Commissioner Dunn.
I just want to say something. First of all, I wasn't able to attend the meeting, but there is another practical aspect of making them more micro-sited, to use terminology, is one of the impediments to getting a shelter open last year to TOO was we didn't have a host city, but we also didn't have a service provider that could step up and provide staffing for a giant facility until the 11th hour as well. And then they were forced to hire temps, and the quality of the care and the quality of the interaction then goes down. This is not a swipe at path at all. I'm just saying, like, it's not our best foot forward in the 11th hour. And so I think the other practical implication there is, if we expect someone to come in and run these, then we have a better opportunity in established places with established contracts for them to add 1 or 2 people for a finite period of time. But no one's going to sign up to work over graveyard shift and then get fired in 4 months. You know what I mean? They want to know that they have gainful employment beyond that. So there is another piece of that isn't just the cities. You got to have somebody in there running those. And you're not gonna get someone to run a big one well, again, I think.
Couple of thoughts. I'm in agreement, like, the letter. On the letter, but, you know, going back over time, we have a physical concept. And then we have done an amazing job with that throughout the town. Yes, maybe they're central and north, but we have a lot of beds now. The thought was when the very first county shelter was bridges, which Todd worked on quite a bit. The thought was you wouldn't use the armories for cold weather shelters.
Don't we have enough beds spread already throughout the county where it can be, you already have a service provider? If you add on to it or you have excess capacity that we don't really need separate cold weather shelters. I do understand there's complexities with the low barrier of the cold weather shelters. But I can tell you, being a host city where there's 2 locations for the entire county, it causes significant impacts because the individuals have a place to sleep and a warm meal, but in the daytime, they stay in the host city and they cause mayhem, and it does impact the residents of those cities.
So I appreciate you bringing that up. And I maybe should have jumped in a little earlier, but part of the discussion, and I think part of the letter that we are drafting, is to point out the variety of models that can potentially achieve our goal. I think what I heard from you is potentially utilizing existing shelter capacity during this time to potentially utilize as that function. I support that. I think that that's a very practical idea. I think that's where Chief Dunn sort of speaks to that sort of takes away the barrier of finding a provider because you already have an existing provider. We're really trying to encourage, what we've seen is that the host city is so incredibly important and the buy-in of the host city is so incredibly important. And we want to make sure that we're engaging in conversation. Like I mentioned, the letter will emphasize and encourage that we are open to different models, whether that is different models that serve your city, different models that serve a region, and we're open for discussion around that because we understand that each city and each region have varying resources, both in terms of physical capacity, also the distance that folks are traveling. So yeah, I don't think the letter is meant to say, are you going to do model A for us? And if you're not going to do model A for us, we really just want to stick to model A. We're really trying to engage in a conversation that says, hey, there's a couple of options here that we think you might be interested in thinking about. We're open for that discussion and we want to hear directly from you. And I think historically, when we've put out open RFPs, we haven't heard anything. And an open RFP, I guess I'd say, is a more passive communication out to the community around interest, where this letter we hope will be a little bit more of an assertive, direct engagement with each particular city to hear from them. Because like I mentioned during the slide, we have heard from a decent amount of cities of their interest in leaning in on it, on some type of response, just not the one we've created. Not to mention, as you opened up, the amount of year-round shelter capacity that has been built during the time of the cold weather shelter existence, I think is hard to ignore as well in this discussion.
Yes, what?
So a couple of things. First of all, I do think that, there's a decent letter response. Is a spot ahead, right? It's just a group of people. So you have to send it to the cities. I don't know whether making a spot was a good idea or a bad one, but there's nobody you can send it to. I do think, though, that asking the cities each to propose how they could service their people who would need a cold weather shelter, and what their ideas about that are, and how to keep that so it doesn't impact the host cities, right? If it's somewhere else, you can't, as Christine brought out, you can't just say, okay, we'll because you were nice enough to be our city, we're just gonna leave these people there during, 24 hours a day, right? You figure out what to do with them at night, in the day too. So I think you need to, ask them for a solution that deals with theirs and, and keeps the ownership on them. I think that's- Letter would be very effective. You will find out who responds and who actually puts some thought into it. Not, that's an important piece of information itself. So I think that could be very useful.
Was it, no?
Real quick, go ahead.
What's the backup plan? Because I am sorry, I'm sitting here. Last year, it was horribly cold, terribly rainy, and we engaged in inhumanity. And we should just acknowledge that. What happened was horrible and it was cruel. So fine and dandy, send the cities a letter and let them say, oh, look, I got a letter from the Homes Commission. Look, if it wasn't for Dave Carter, we wouldn't have bridges at Kramer. We wouldn't have cleared the riverbed. We had a federal court that basically kicked the crap out of us and threatened us. Now he got higher courts telling him he couldn't do certain things. But the fact of the matter, it took that kind of do this or else from Dave Carter. So what I'm saying is, what's our backup plan? Like, to Commissioner Ridge's point, are we gonna erect a tent in the back of Kramer? In the holding area? I mean, what is our backup plan? Because in the event, and I hope I'm wrong, but I'm not gonna be wrong, not one city is gonna respond or do anything. They're all gonna say it's somebody else's issue. And then we are gonna be like close to the problem and we're gonna be in a world of hurt. So it is slightly irresponsible not to have our own plan in the event the cities don't respond in the way we believe.
Well, it's not this commission's plan or responsibility to actually come up with one. And I do see my CEO chomping at the bit to say something.
Is Frank behind me?
But we talked earlier on about carrots and sticks, and there are just not a whole lot of sticks that the county or the commission has with respect to the mayors. And I will agree with you completely. As a former mayor, if I got this letter, I would say, gosh, that's interesting. Go
That's
ahead.
my point.
Yeah. No, I don't disagree with you. Go ahead. All right, hang on.
Thank you, Frank.
Where you go, Frank?
Just
Go
a
ahead.
couple of things. I think that we know there's not like this overwhelming interest for everybody to say, how can I help? That just hasn't been the history and background here, but there are now more shelters than what we had before. So those cities that have agreed to host and have shelters in their areas, the hope is that, and the belief is that they will say, rather than hosting a cold weather shelter solely in their city, they'll say, yeah, 10 beds is better than 200 beds. So, that might be the sort of the encouragement, the incentive to say, look, if I can set aside 10 beds in my 100 shelter site, then that's a pretty good, compromise, right? Hopefully those existing network of shelters will be the first ones to step up. And those are the ones I'm hoping we can lean into first, right? And say, look, let's have these offline talks and hopefully, Doug, Frank, and others will say, let's work this out versus, by the way, you have a shelter, but we're still gonna, lean in and you have to do another 200 beds someplace else. Plan B is that. I don't know how we force that on a city. I think that, here, if we can get started with this process, at least early on, we can try to see what the response is with those existing shelters.
Go ahead.
So just Frank Kim from the County Executive Office, Orange County. Just a couple of points I want to share with the commission members. One, earlier this year, the board committed to jointly funding with the city of Garden Grove, right? The establishment of an 85 to 100 bed shelter there. So that site acquisition is already complete and they'll start construction soon. So we're adding additional beds, right? In a region that I think will benefit from it. And they're doing that in joint support with the city of Westminster and Fountain Valley. So we're supporting regional, right, enhancement of the capacity for beds. Additionally, we, in this last month, completed our construction project out at Bridges at Kramer Place. So that added 80 beds, of which currently I think the number I saw this morning was 70 were still vacant. So we just added an additional 80 beds. So if you compare where we're going to be with where we were a year or 2 years ago, we continue to put additional beds online. So the idea that the county is not participating by establishing increased capacity, I want to make sure that the commission members understand we continue to invest. We're continuing to add capacity, right? A typical cold weather program generally has 100, 120 individuals when it's cold and rainy out. When it's not, the numbers can drop significantly below that, where they're kind of in the 40s and 50s. So that's kind of the range of people that take advantage of those programs. And I'm also smart enough to know that we don't have all the best ideas. So engaging with cities and starting the conversation about what options may exist for perhaps microsites. We've had some individuals or entities come to us and say, gosh, in our local community, we might be interested. Would you have any funding support? So we've got a certain amount of money that we had set aside to support a cold weather program. If there are communities that want to take on 10 or 15, I agree, the chances are fairly low, but what if they step up and say that they want to do that? In addition to the 80 beds we just added, in addition to hopefully a year from now when Garden Grove opens, then I look at that and say, gosh, over a short 2-year period of time, we would have added 160, 200 additional beds. That's a good thing. So we're still working in this space. And so I see the letter as at least the right option to at least start the dialogue with those communities. And there may be additional ideas that come out of that.
I would move the recommendation as listed, sir, if you'd like.
All right, there's a motion. Is there a second? A second. Discussion's not over. Commissioner Cornwall.
I just want to kind of echo Commissioner comments, especially when you look at this map, that South County does not have enough beds last year. And I really appreciate all the work that's been done by the county to increase beds and the new pieces that Frank just talked about in the Garden Grove. I can share as a hospital system, our residents who are homeless had no ability to get to those cold weather shelters last year. We had, I can remember a patient that was found in one of our local cities that had a body temperature of 80 degrees. He came to the hospital, he was in a coma for several months and passed away because he wasn't able to survive. So when I see, I love the work that's happening in Anaheim, Garden Grove, all those cities that are central and north, but we have to find a solution for South County. And it can't just rely on that one little dot that's in Laguna Beach. It's got to be more than that. And so I don't have, like I'll say from the healthcare system, I don't have the solution for what that is or what civic mandates, controls, whatever you want to call it. I think the letters to the mayor is a great first step. I would be kind of, I'll say cautiously optimistic. But there has got to be a solution that we discover for South County.
Of course.
Besides having reached out to the mayors, can we reach out to churches, nonprofits? There are many that would, I think, be very happy to do a micro cold weather shelter. And if they desire, they could talk their own city councils and cities into doing this.
Yeah, I think we've discussed that. We're open for it. I will note, but like you mentioned, Robert, the interest in the smaller site. Our RFP these last several years haven't excluded faith-based groups from responding, and we have not heard back. But that was for a larger, more central site, arguably, I'll say. But yeah, I think that that's something that we're interested in as well, as potentially explained.
We are really close to 3 o'clock and have a few more things to do. Anybody else?
1 minute is close, yeah.
All right, there is a motion on the recommended action, which is the letter to the is up there. Any opposition or abstentions? Matter for both. I think let me clarify, the motion was for
A and B.
A and B, the staff recommended actions. All right. Any opposition or abstentions? Matter carries unanimously. And that brings us down to item 5. Madam Clerk, if you would read.
Item 5 is to approve the recommendation to the Board of Supervisors to update the Commission to End Homelessness bylaws to incorporate a voting member seat for a managed care plan representative. And we have no questions.
All right, that's been teed up earlier by Mr. Beck. Go for it.
Sure. So with the implementation of CalAIM and the infusion of critical housing and homelessness incentive program dollars, just to name a few contributions to our homeless service system over the last several years by our county's Medi-Cal managed care plan, there's been continued discussion on how our managed care plan plays a critical role in shaping our efforts to address homelessness here in our county. And due to playing that impactful role, having a seat on the commission may help strengthen the collaboration, coordination of those resources. Those are things that have been discussed. With that being said, the action item in front of you is to approve the recommendation to the Board of Supervisors to update the Commission to End Homelessness bylaws to incorporate a voting member seat for a Medi-Cal managed care health plan representative. If approved, this recommendation will be brought up to the Board of Supervisors for approval. If that approval occurs, we will come back to the Commission in October to get approval for the recruitment of that position. And I'll hand it back to you.
Discussion.
I have a question. What's County Council talked about when they have to recuse themselves if they're a potential beneficiary of a recommendation to the board? In other words, if you said, hey, Cal Optima, we should get more, what, if somebody's a recipient and they're a voting member, they have to recuse themselves. What are we gonna do? I'm asking, I'm not your lawyer. What is County Council telling us about that?
I don't know the county council's telling us anything about that. I don't know that the question's been asked, but more importantly, this is a recommendation body. This isn't a body that awards contracts or otherwise would directly stand to benefit them, but it's a question worth asking if it hasn't been already.
I'll be transparent, it hasn't been asked. I was about to sort of mention the same piece. If the commission were to feel more comfortable for me to ask that and then come back to our next meeting with that.
I'm not interested in delaying it. I think it's a good idea. I think their input's great. I just want to make sure we don't get any criticism that somebody's advocating for something that they could end up being an indirect beneficiary. So if you could handle it, as part of the, the research you're gonna do, Mr. Chairman, I don't mind doing it subject to, because I don't want to waste any more time. But I would appreciate if you'd run it by County Council.
I think it also, there's some similarities with some of the providers on board. So yeah, I'll absolutely.
Well, it would apply to anybody. I mean,
Exactly.
if United Way was, I would want to make sure Commissioner Parks didn't put herself in harm's way. So it's probably good guidance for anybody who might be a beneficiary.
Appreciate it. I'll look into it.
Is that a motion? That was a motion. I'll second it.
There is a motion.
That wasn't artful at all.
Motion by Commissioner Spitzer. Seconded by Commissioner Dunn. All right, further discussion. Any opposition or abstention to note? Seeing none, item carries unanimously, and you will check with County Council.
Absolutely.
All right, that brings us to the public comments portion of today's festivities. Any member of the public wishing to speak on a non-agenda item that is under the subject matter jurisdiction of the commission may speak at this point. Madam Clerk, do we have any requests to speak?
Yes, we have 3 questions.
Call the speakers, please.
Our first speaker is Gina Cunningham from Homemade Orange County.
Good afternoon, everyone. Thank you for having me here today. Not to add to the concern that we have about emergency shelter, but if you put that map back up, I want to make it known that there is another emergency shelter in the city of Orange. It is privately owned by Homemade Orange County, and it is explicitly helping families. We have been open in the city of Orange for 6 years. We've helped nearly 1,500 humans and their homelessness at the Family Care Center. And about 360 families have been able to come through there and move on to their next house. It is owned by Homemade, but is operated by our partners at Mercy House. And they have had great success in moving families on out of crisis and into housing. And we attribute that to being part of the Family Solutions Collaborative here in the County of Orange. Unfortunately, we are facing a shrinking revenue base of sustainable operational funding. And I'm here just to let the leaders know in this county, especially those here in the Commission on Homelessness, that if we don't find some operational funding for the care center, we are facing closing at the end of the year. This will lose 56 to 70 beds in our county. And it breaks my heart to think that Homemade privately fundraised to build this shelter, and that we have saved this many families and we are facing this crisis. So I would just ask the commission to please consider also bringing family homelessness into your discussion. And if I call you, because I will be calling somebody soon to come and meet. I love the idea of having all of the cities be able to come together to help. We are serving cities, families from every city in this county. So Central and North, mostly, but there are some people from South County that take care. So please answer my call and thank you for letting me speak.
Thank you very much. Next speaker, please.
The next speaker is Carrie Buck from Family Solutions Collaborative.
Good afternoon. Thank you for your time today. I just wanted to reiterate our focus on families. As the executive director of the family, recently, I don't know if you've seen it, the Conditions of Children's Report in Orange County came out, released by First Five. The areas that they stated that we need to prioritize are physical fitness and nutrition, behavioral health, chronic absenteeism, child welfare, preventable child and youth deaths, and housing. Housing is the way to improve all of those other areas. Without stable housing, the other areas simply cannot improve, and the overall welfare of the child is at risk. With stable housing, stable and secure housing, children can attend school regularly and don't miss as many days moving from place to place and school to school. It's easy to get lost in the shuffle when you aren't at a school for very long. Long-term supportive relationships with friends and teachers just don't materialize. When students are regular attending school, they participate in physical education classes and have access to meals, 2 a day and a snack. Children who have a full belly retain more and learn faster when they are hungry and if they don't get a healthy meal. Thereby, being at school improves their overall health. Children are happier when they have a home where routine and structure can be developed. Parents are happier when they can provide that structure to them. Imagine how hard it would be to have your children do homework, settle arguments between siblings, all while you're either on the street or in a car. Families need a home where they can cook and eat together and also study. Adults don't have to worry about how they will put children to bed at night, and if they have a home. And without a home, it creates a stressful and traumatic situation for those kids and for the families. Homelessness limits regular engagement and healthcare providers, as also was mentioned today. Families with regular stable home have parents that can plan and schedule doctor's appointments. Children can receive preventative appointments so that they are healthier and grow up to be healthy, instead of growing up at a higher risk of becoming an unhoused adult. The funding for family shelters and housing navigation has been shrinking for families. Some FSC organizations have reduced the number of emergency units already due to funding losses. There have been a reduction in other funding for family shelters and housing navigations to house families with children, especially those aged 0 to 5. There's been a concerted effort to expand shelter for individuals in the last 4 years, which is fantastic. There's also requests to set aside money for TAY, domestic violence, veterans, and seniors. Families are also part of those groups. Domestic violence survivors, TAY young people, veterans, and even some families have seniors. So please don't spread the funding too thin, and make sure that you're focusing on our most vulnerable who don't have a choice. Thank you.
Thank you. Yes, wait, or not. Real quick.
But the funding is shrinking. From what areas is it shrinking?
It's shrinking from our shelter system, our emergency shelter systems, like was mentioned, from Home Aid. Pathways of Hope has had to change some of their programs from emergency to permanent supportive housing. And First Five Orange County, which has done a lot of funding for us countywide because of the tax on cigarettes and the reduction of cigarette smoking. Their funding has also shrunk, which has impacted us, and we've lost funding in those ways.
All right. Next speaker, please.
And our last speaker, and I apologize, Madeline, if I pronounce your last name wrong, Madeline. Okay, from Families Forward, thank you.
Good afternoon, commissioners. I'll try to keep this brief as I know we're after time. My name is Maddie Hernies. I'm the CEO of Families Forward. I'm the tail end of the Family Care Founding proud founding member, one of the founding members of the Family Solutions Collaborative, and I wanted to talk to you about the state of family homelessness and the harsh realities and trends that we're seeing. Definitely want to echo my colleagues' sentiments, but it's much more than just shelter. It's actually a flow out of shelter. As Families Forward is 2 out of the 8 access points for our family system. Prior to the pandemic, we were receiving about 64 family request forms a month. So it's a combination of literally homeless and at risk of. At the peak of the pandemic, where we thought, oh my gosh, I can't believe it, we're at 181 a month. Last month in July was 327. The reality is the COVID funding is going away and the need is higher than it was at the peak of the pandemic, and we can't keep pace. With the Family Coordinated Entry System, so this is our system that manages the families experiencing homelessness, last June we had 190 families on that list. Last June, June of 22 was 190. June of 23, 330. We're going in the wrong direction, and it's much more than just 330. I think it's misrepresented when we have 330 as our placeholder. That's 1,470 children and adults. So we wanted to create awareness that family homelessness is growing in the wrong direction, and we're seeing trends where the funding is being shifted, and we know it's a pendulum swing and we see kind of ebbs and flows, but we wouldn't do our job if we didn't advocate for the families that are living in places not meant for human habitation, and to support not just shelter and increasing access to shelter, increasing flow through shelter. We can add more beds and we need to add more beds, but we're only going to create a bottleneck if we don't have housing opportunities to get families out of shelter. And shelter is no longer 30, 60, 90 days. It's 8 months, 6 months. How do we create more housing opportunities for our families that we serve? So I just wanted to advocate not only for what Supervisor Sarmiento mentioned is prevention. How do we create upstream services? Make prevention a part of our system, our homeless response system here in Orange County. The COVID money was a catalyst for that. We can't let it go away. It has to stay. And the Family Solutions Collaborative, Families Forward, we're here to be the advocates for families. And just really wanted to thank you for your time and your support and for listening to our little three show here. So thank you.
All right, thank you to our Family Collaborative folks. Appreciate it. We are now at Commissioner comments. Any? Oh, good answer. That brings us to the end of today's agenda. Our next regularly scheduled meeting will be Wednesday, October 18, 2023 at 1 p.m. Thank you all. Dr. Morris, thank you very much. We stand adjourned.